This is your guide to misaligned and flat feet. Flat feet, or what's known in the medical world as pes planovalgus, is a complex disorder resulting in the loss of normal alignment of several bones in the foot. The treatment of flat feet depends on the severity of the condition, and the typical treatment can range anywhere from an arch support to complex rear foot reconstructive surgery. Now, it's really important to understand that your feet can dramatically affect your quality of life. So misaligned feet are not a good thing, and you can have misaligned feet regardless if you have a low or high arch. So usually, and it's just a matter of time until those misaligned feet lead to functional symptoms. And what I mean by functional symptoms is that the more active you are, the worse your pain. And the less active you are, well, the pain isn't so bad. So if it hurts, then you don't do it. You stay off of your feet and you become more sedentary. And so whatever you do, if it hurts, it gives you the pain. So like for instance, if you exercise. So if you suffer afterward, you don't continue to exercise. Your metabolism decreases and other problems begin. So you're not burning off the calories. So the weight starts to get increased, which leads to obesity. Obesity leads to a high blood pressure, diabetes, and heart disease. So a lot of people with hypertension, diabetes, and heart disease are told to go out there and exercise, but it hurts when they do it, so they don't. So a lot of people who have misaligned feet don't have pain in their feet. Now you have to remember that pain is a symptom that something is wrong. And the symptom or the pain is going to show up at the weakest link in the musculoskeletal chain. So if a lot of people say, well, I know I have this misaligned feet, but I don't need to worry about it. Well, you might not have those symptoms yet, but should you treat your feet as the tires on your car? Because we balance the tires on our car right away. And we could put the tire on the car without balancing it, and it's going to function for a while, but eventually the tire will wear out. It's only a matter of time. And so not only is this going to affect that single tire, but it can affect the other tires and even the steering of your car. So the steering is off and you just can't figure out why. Well, it comes back to the alignment of the tire. So one thing that we have to remember is that the average person takes nearly 7,000 steps a day. And after 50 years of walking, that equals 120 million steps. So if you ever heard anybody say, wow, I just turned 50 and it seems like my body's falling apart. My knees are hurting, I have achy back, and I don't get it. I used to be so active, and now I can't be active because of how much pain I'm in. So this graphic really helps to show that our feet are the foundation to the body. And so the image shows normal hindfoot alignment. People with normal hind feet alignment, they're able to go out and walk and exercise, and it doesn't hurt. It doesn't hurt to breathe, and it shouldn't hurt to walk or exercise. Now we see what happens when when we have a misaligned foot and the ankle turns in. So not only does that affect the foot, but now it affects the knee, the hip, the pelvis tilts, that then immediately puts a strain on the back. So the difference between an aligned or a misaligned foot, it all depends on the stability of the ankle bone on the heel bone. So there's a pathologic condition called partial talotarsal dislocation. And so this is different from a flat foot. Now, it can be part of a flat foot, but again, the flat foot is a complex rear foot disorder. So let's take a closer look at this. On the left we see the normal hindfoot alignment. The talus or ankle bone is stabilized on top of the calcaneus with many different ligaments. And there's a yellow circle there which indicates a natural opening in between the ankle and heel bones, and this is called the sinus tarsi. The sinus tarsi should be in a pretty much open position all the time. Now you're going to see also a vertical arrow, and what that is pointing to is the navicular bone, which is in front of the ankle bone. And that bone should sit on top of the cuboid bone, which is in front of the heel bone. Now you can take a look on the right side x-ray, and you see that the ankle bone has partially displaced on the heel bone. And now that open sinus tarsi has collapsed. The ankle bone has fallen down, which has displaced the navicular bone. So you can see how that vertical arrow has shrunk. But this patient does not have a flat foot. There's a calcaneal pitch angle, which is the angle of the heel bone to the ground. And in this patient, it's normal. So we cannot diagnose this patient as having a flat foot. Rather, this patient has a partial talotarsal displacement or dislocation. So you can have a partial talotarsal dislocation without a flat foot. So how are we going to treat this misaligned foot? And it really depends on the flexibility. The more flexible, the more options we have. The more rigid it is, well, our options are going to be kind of restricted. So a lot of people are treated by using an arch support or custom molded arch support, which is called an orthosis or orthotic. And these are placed inside your shoe. So the question with this comes, how can something placed under your foot fix something above the foot? So this deformity is occurring above the calcaneus, not below the calcaneus, the heel bone. And so is there objective data showing that these can actually realign that ankle bone? So here are several x-rays showing the comparison between a barefoot with partial talotarsal dislocation placed on a custom molded arch support. And we see all those yellow arrows on there, and there's really no change, minimal change in the alignment of the ankle bone. So there's various measurements that we take, and all of these are still in a pathologic alignment. They're in a bad alignment. So a lot of people are wearing these arch supports thinking that it's realigning their feet, when the reality is quite different. So now I want to talk about something else that a lot of people just are not aware of. And this is a procedure called extra-osseous talotarsal stabilization, or EOTTS. And this is a procedure that can be used in a flexible, reducible talotarsal displacement. So this is a minimally invasive procedure that is permanent, meaning that once we place the stent, this a little titanium device, into the hindfoot, it should stay for the rest of your life. Yet it's reversible. So it's a peace of mind thing to know that if for some reason there happened to be any kind of a problem, well, we can make a small incision, pull the device out, and worst case is you're right back to where you started. So this is a time-tested and evidence-based procedure that has been performed on children and adults for decades. And I think we're going to learn that this just makes sense when we're treating a partial talotarsal dislocation deformity. So the EOTTS device, and this is the HyProCure device, and there's a lot of different stents or sinus tarsi implants that are currently used, but you'll see when you go out and do some more research that this one is the most superior device out there. And we're going to talk about that in a few slides. Now, some people think that these devices are put into a joint, and they're not. They are extra-articular. That means that they are placed outside of the cartilage, which is what forms the joint. And that's really important because we don't want to impact or put anything into the joint. It's not nothing. It shouldn't be in there. Now the other thing too is that this is extra osseous. What that means is that these devices are not screwed into bone, but placed in between the bones. So it's not like an orthodesis or where the bones are fused together. So this device still allows the normal range of motion. It just takes away the excessive motion. Now, the HyProCure stent is classified as an internal bone stabilization device. It basically prevents the abnormal collapse of the sinus tarsi. It's made of medical grade titanium. This is about the best substance we can put in our body, so it does not fragment or wear out. It's harder than bone. It does not set off metal detectors either, so we're always asked that question. So where's the proof? Well, this is a internal correction for an internal deformity. So a small incision's made on the outside of the ankle bone, and a sizing is performed. There's 6 different sizes of these stents, the HyProCure stent, and once that is determined, it's pushed into place. The soft tissues within the sinus tarsi attach to the device, and that prevents it from displacing. So before, on the x-ray on the top there, we can see all these different arrows indicating the abnormal alignment of the ankle bone on the hind foot, showing a misaligned foot. Then, once the HyProCure device is placed into the sinus tarsi, we can see that all of those pathologic angles have been restored back to normal. So the great thing about this is that it does not rely on external devices for correction, meaning whether you're wearing shoes or going barefoot, the device is inside working, unlike an arch support that only works while you're wearing the shoe with the arch support in it. Now, the EOTTS procedure has many benefits, but there's also some risks. So of course the benefits include that this is an internal correction that has been proven in scientific literature that it effectively stabilizes the hindfoot. It's not dependent on external factors such as shoes or braces, and it should be a permanent solution, but again, it can always be resized or removed if necessary. Unlike the traditional rear foot reconstructive surgery, that once you do that procedure or have that procedure performed on your foot, you cannot redo it. So some of the risks that are associated to this procedure is that sometimes the stent can become displaced. You can have a period of abnormal walking, pain, or swelling. And there's going to be a period of soft tissue adjustment, getting used to your new foot. The medical evidence has shown that there's about a 6% of the patients that will need this device removed. So nothing works for everybody. And there are other risks that are associated with surgery. Well, I hope that this has been an informative presentation for you. Please visit alignmyfeet.com to learn more about this condition. And at the end of the day, the goal is that we don't want to let your feet slow you down. So this is a great option for you. So thanks a lot for your time, and good luck.